Okay, so paid care sector. Oh, by the way, last time I don't think I said my name correctly. So my full name is Jooyeoun Suh, but goes by Sue. So call me Sue for those who haven't noticed what my name is. Okay. Okay, so the goal today is to similar to the unpaid care sector, I try to demonstrate the quantitative significance of a paid care sector, employment and workforce, and help motivate a more unified framework and help develop better care policies. So let's see whether we can do that. So what is a care sector? We have talked about this before. So what's distinctive about care sector? And paid and unpaid, it's same. And those work involve the personal interactions and the emotional attachment. And it also concerns for the well-being of the care recipient. And that concern is is likely to affect the quality of care services that caregivers provide, whether in paid care sector and unpaid care sector. And it also developed human capabilities in health sector, education sector, and social services in most of the cases. And as we have seen and heard from the previous session, women are heavily concentrated in those sectors. And in many countries, women of color or women with a lower socioeconomic status bear a greater burden. So let's see. So why care is unvalued? We learned from Nancy that it creates a lot of value than it is actually able to capture. That's the sense in which it's subsidizing many other areas of the economy. But historically, patriarchal institutions made it hard for women to work anywhere but provide care work, especially childcare and elder care and housework. That restriction to care work crowding them into put downward pressure on both the wages and the rewards of engaging in care work. And even today, commitments to care to family members or to caring for others are costly, and they tend to reduce economic bargaining power. So this is all well-known feature. And oftentimes women are not in the labor market because they say they have caring responsibilities at home. So unpaid care work is a critical determinant of a women's time use patterns and women work pressures, and it is often articulated as being the most significant barrier to women's participation in the labor force. So this slide shows globally the principal reason given by women of a working age for not being in the labor market, in the labor force, was unpaid care work. And it was about 41.6% for women. So that was, for men, the main reason was not unpaid care work. It was more of being in education, or they're sick or disabled. And about 44% of men answered that was the main reason why they are not in the labor market. So the ILO report called Care and Care Work, I think, it was released in 2018. And care work consists of two overlapping activities: direct, personal, and relational care activities, such as feeding a baby or nursing an ill partner, and indirect care activities, which is such as cooking and cleaning, those kind of definition was also used in the definition of in defining unpaid care work as well. And unpaid care work is a work provided without a monetary reward by unpaid caregivers. In the unpaid care sector, we learned that unpaid care work is considered as work and is thus a crucial dimension of the world of work. In this report, the way they defined paid care work is as work performed for pay or profit by care workers, paid care workers. They comprise a wide range of personal services workers, such as nurses, teachers, doctors in healthcare sector, and personal care workers as well. And also they included domestic workers who provide both the direct and indirect care in households. And also they are a big part of the care workforce. In this report, they showed that the paid component in healthcare services, long-term care services, education services, including early childhood development and education services, domestic workers, personal services, those correspond to close to 400 million workers around the world. And that's representing almost 12% of global employment. And about 20% of global female employment, and also about 6.6% of global male employment are in this care workforce, paid care workforce. And as an extension of the gender distribution of unpaid care work within the household, the majority of the employment in the care industries in paid care work are women, as you can imagine, not surprising. And 2/3 are women in some countries, and this is much higher in some other countries. But on average, overall, at the global scale, there's about 2/3 of women. So 1/3 of men, that's not insignificant, don't you think? We'll get to that point later. I thought that it's a pretty oh, that's really high, even for men. I thought it's most of the women are working in the care sector, but yes, predominantly women, but not insignificant number of men working in the care sector. Because of the definition of a paid care sector that ILO used in this report. And care work is a significant source of employment globally, particularly for women. There are significant regional variations in the patterns of care employment, except for the Arab states, which is the tall bar in the middle. The bigger the care workforce as a proportion of a total employment, the more feminized it is. Especially in the Americas and Europe and Central Asia, the total care workforce comprise almost 20% of total employment, and over 1/3 of female employment, and the rate of feminization of the care workforce is over 76%. So it varies, but except for Arab states, it's a pretty similar to each other. And these care workers globally are not distributed equally. So countries vary greatly in their size and level of development, as well as in their labor markets, market conditions, and migration policies, and the extent of their health, education, and care services. these variations influence the levels and the composition of a care employment. This is cluster analysis they did. And so they only selected 99 countries that they were able to get. Because in the report that they used the 189 countries, they try to get the micro data as much as possible in all these 189 countries. But anyway, for this cluster analysis, the care workforce in 1999 countries identified 8 distinctive models of the care employment. So 2 main sources of a variation. The first main source is the proportion of employment in health and social work driven by the coverage of healthcare and long-term care services. And then the second main source of this variation is the proportion of employment in domestic work. So there are regions that face a deficit of care workers, both in education and healthcare. And in some regions of the world, for example, the yellow region on the map, they are relying on domestic care workers heavily, who have the worst working conditions, as you can imagine, in the global workforce, and high levels of informality, and have been particularly hit by the COVID-19 pandemic as well. What this analysis indicates is that policy really matters in determining the level of employment, working conditions, pay, and status of care workers. Migration policies, labor policies, and the coverage of the design of health and education and care policies as well. So public provision of care services tends to improve the working conditions and pay of the care workers, whereas unregulated private provision tends to worsen them, and irrespective of income level of the country. And that was the ILO report. And there's another report that kind of looked at the paid care sector across the globe. And it's one of the working paper series by UN Women. I think it was commissioned by UN, and Duffy and Mignon Duffy, and then Amy Armenia in 2019, and then it's finally published on the UN website. So you can actually see the prettier version of the one that you have as a reading materials. So the goal in this paper is to provide a comparative analysis of the paid care sector across a large number of countries located in different regions and in differing positions in the global economy. So this report has 3 parts. First, estimates the size of a paid care sector, just like the ILO report. And I also provide an occupational structure of the care sector across the national and regional contexts, and whether the size of a care sector is a match or mismatch with their care needs in each country. And their analysis used a comparative approach to examine the paid care sector in 47 countries. And they used 2 data sources. One is LIS, Luxembourg Income Study, which has harmonized, it's I think over 50 countries. Labor force surveys are harmonized in the Luxembourg Income Study data. And then they also used IPUMS, which is monitored and then monitored by the University of Minnesota. The Minnesota Population Center is controlling that IPUMS international data. So they chose these data sources because they included in labor force data from multiple countries that have been harmonized already and are specifically intended to be used comparatively. So yet there are 47 countries they used in this study. So there, it's very similar to the definitions that are used in the ILO report. So the activity of the industry or occupation contributes to physical, mental, social, and or emotional well-being. The primary labor process involves face-to-face relational relationships with those who are cared for. And those who are receiving care are members of the group that by normal social standards, it cannot provide for all of their own care. So those are those who can't take care of themselves because of their age or illness or their disability status. So they are the care recipients in their study, in this study. And paid care workers are in the following sectors. One is healthcare and K-12 education and childcare, and then other social services. So the occupations that are included in this study as a paid care occupations are doctors, nurses, teachers, childcare workers, social workers, and home care aides. The size of a care workforce in all 47 countries by calculating the proportion of the paid care labor force that's employed in a care industry. And the overall size of the paid care sector ranges from a low of 3.5%, that's on the far right-hand side, which is Mozambique, using 2007 data, to a high of 27% in Denmark. As you shown earlier in the ILO report, they also, these Duffy and using the LIS and then IPUM's international data, they also show that paid care is overwhelmingly performed by women. So the blue bars are all performed by women, and then the gray bars are for men. This figure shows that women make up over 70% of paid care workers in the majority of the countries, and over 80% of paid care workers in 11 countries. And so there are two trends in this graph. In Egypt, Iran, Palestine, the rates of female representation in the care sector are much higher than in non-care jobs, but both rates are considerably lower than in other countries. And the second interesting point from this graph is the smallest care sector overall is in sub-Saharan Africa, Ghana, Malawi, Mozambique, and Nigeria in particular. And women are actually a larger portion of the non-care workforce than actually of the care sector, which is interesting. So care sector by, this graph shows the breakdown of each country's care sector and showing the percentage of the workforce in education, health, and social services and domestic work. So the bottom, the blue bar is education, and then the middle one, the lighter colored one is health and social services, and then the top darker brown is domestic workers. In the developed countries, as you can imagine, where the care sector tends to be the largest, both the healthcare and education sectors, those are big. And domestic workers are a large presence especially in Latin America and the Caribbean, making up between 30 and 50% of the care sector across most of the region. And some other studies have looked at their paid care sector, and they used a much narrower definition of a paid care sectors and paid care occupations. For example, doctors are not included in those studies, in these studies, and then sometimes even in the education sector, they only included the kindergarten teachers instead of like the teachers in tertiary education, which was included in both ILO report as well as a UN report. And just 3 weeks ago, ILO released another report called the Domestic Workers, and making decent work a reality for domestic workers. So more than 10 years ago, the Domestic Workers Convention, which is called Convention 189, was adopted at the International Labor Conference, recognizing for the first time in the international law that domestic work is work, and the domestic workers are entitled to all of the fundamental labor rights, just as other workers. So it changed the way that the global community approaches this essential sector. After this convention last 10 years ago, the ILO has concluded a comprehensive research that assess how far we've come in protecting domestic workers, what's changed and what hasn't, and what emerging issues are being faced as a result of the COVID-19 pandemic. So this one just released, and really interesting figures and interesting analysis that was included in this report. And you can click this cover, which will take you to the report. So there is this hyperlink embedded in there. So this report consists of 3 parts. First, it provides a global and regional estimates of the number of domestic workers. Not all domestic workers are in care sector. Many domestic workers are not. Many male domestic workers are not in the in care sector. So this is just the domestic workers that the ILO defined, which we're going to look at on the next slide. And second part provides information on the extent to which domestic workers are covered by labor and social security laws. And third and final part looks at the implementation of those laws. Implementation is to look at the actual working conditions of the domestic workers, time. They also look at time and wages and share of domestic workers who are still in the informal employment rather than formal employment. So domestic work is defined as work performed in or for a household or households binding employment contracts. So this definition has often meant to a lot of people only those domestic workers are hired directly by households, but in fact, the scope of definition is broader. This includes domestic workers who are hired through service providers, whether they are employed by the service providers. So this includes all domestic workers, whether they're employed by the service providers or by the household, individual households. Or if there is more complexity in the employment relationship. So these are all domestic workers. And while domestic workers typically undertake cleaning and cooking and caring for children, elderly people with disabilities, so they also tend to perform gardening, driving, and guarding private homes. And their tasks vary across countries and over time. So given this heterogeneity of tasks, the defining characteristic of domestic work was depending on where the workplace is. That's the home, that's the household. So around the world, there are about 76 million domestic workers aged 15 and over. let me go. So there's 70.6 million domestic workers, according to their the ILO definition. And this figure includes a live-in and live-out, part-time and full-time, everybody. Those who work at home, somebody is at home, regardless of the number of hours worked, as long as domestic workers are consider it to be their main job. So those are all included in this figure. And 75.6 million number represents a 4.5% of the total number of employees in globally. And this proportion reached more than a third of women employees in Arab states and 17.8% in Latin America and the Caribbean. So as I said, domestic work includes a lot of non-caring jobs as well. Maybe you can think guarding a home also is a caring job, but anyway, the women continue to make up the majority of this sector globally. So 76.2% women, meaning that a quarter of domestic workers are men, which is, I found it really surprising. And it's important to note that the share of women among domestic workers is very high in some regions, like in Latin America and in Europe. But in the Arab states, the bottom on the left-hand side graph chart, men outnumber women, and they represent 63.4% in the domestic work. The world's largest employers of domestic workers in numerical terms are Asia and the Pacific. So they, in Asia and the Pacific, the region is the largest employer of domestic workers, and it's a home to 38.3 million domestic workers, which is about 50% of all domestic workers worldwide. In contrast, the Europe and the Central Asia region employs the smallest share of all domestic workers. Okay, what you see here is that domestic workers, male and female, tend to be clustered in particular occupations. Male domestic workers tend to be worked more as gardeners, as you can imagine, and chefs, also chauffeurs, those who are driving. Whereas women tend to work as cleaners and direct caregivers. It's hard to see what's what, but once you have the slide, hopefully you can see that. So far we have looked at different reports, different definitions, and similar, but a little different, but not much different. So I want you to think about how would you define paid care sector, and then what kind of occupations would you include in your paid care sector, and why? Would you consider doctors to be included in paid care sector or not? And how does that, what's the implications of including those doctors or high-paying jobs in the paid care sector? What are the implications of that? So, and what, if you know your country's paid care sector, then can you share what you know about your the paid care sector in your country? And then how would you measure the and estimate care demand? Because of, there is a demand and supply measures. And in Mignon, Duffy, and Armenia, their report, they did look at the care demand. But oftentimes the care demand is depending on the number of kids or number of children or number of elderly persons, 65 and older, and then 15 and younger. So those are oftentimes considered to be care recipients. Is that the, okay definition? Like, is that is that how you would define the care demand in the near future? Okay, so this session, I'm going to look at Korea in particular, more specifically. And before I do that, I need to share my screen. Okay. Okay, and you guys see the fertility rates declining. Do you remember Ito yesterday or last week talked about Koreans might be extinct, disappear forever? So that was I think it was done using the 2011 data, which was the fertility rate was back then was about 1.19. And if that number continues, then Koreans might disappear by 22,750, according to one of the speculation or estimates. However, fertility has dropped even further. So, Koreans might disappear even sooner than we don't have to wait until 2,750. But anyway, last year, 2020 was the lowest of South Korea's total fertility rate dropped to 0.84, so less than 1. And what's the total fertility rate? What is the replacement? The rate is a 2.1, and there aren't that many countries now left over 2.1 with total fertility rate. So anyway, this was the lowest rate on the record, which is not showing on this this graph, but that was there has been sharp drop in the number of marriages during the COVID-19 pandemic, but that was not because of COVID-19. It has happened before, and it has been fueling concerns that the number of births could shrink even further in the future. And for the first time in Korea, 2020, the number of people who died in 2020 was bigger than the number of people being born in 2020 in Korea. So, there are some concerns, but do we really need to worry about that? Anyway, let's see. So another demographic change that you may see very often it's from, I really love this, data visualization. And it's from BBC or maybe Guardian. I'm blanking, but anyway, the share of those who are 65 and older in 2019 was about 15% of the Korean population. And in 2020, it was about 16%. And by 2050, that number is expected to increase to over 38%. So there are the pyramid is no longer looking like a pyramid, especially in Korea. So in this report, in this paper, I try to estimate the paid care sector and what's the best way to estimate paid care sector in the Korean context, and who should be included in the paid care sector, and then what are the conditions of those paid care workers in paid care sector, and then what are the policy implications of those estimates. So that's what I try to do. And the definition is mirrored with the definitions that are used for the unpaid care sector. So face-to-face and also support workers as well as a supervisory care. So those people whose occupations involved in these kind of activities and supervision are included in the paid care workers. So I used 3 different sets of data sets to calculate the paid care sector in Korea. Local area labor force survey. This is it was the it was the most detailed data that I could get in many different occupations. And it did have an hourly wage as well as some detailed occupation or occupation code that I could use. Yet it wasn't enough, so I also complement. I used the different data sets for childcare specifics, childcare statistics. That's also another nationally representative sample number. And then also long-term care insurance and statistical yearbook for estimating the number of people in the long-term care sector. Okay, so who is included in those sector? So there are four the broader sort of sectors that I looked at, and one is the social welfare service related workers, and the other one is kindergarten teachers. Sorry, it was not sector, it was an occupation. And then the other one is third one is medical and welfare related service workers, as well as domestic chores and infant rearing helpers. Those are mostly domestic workers, as we have seen in the previous session. And here I intentionally limit these occupations, only including those in the low-paying occupations, and then doing and heavily feminized, heavily female occupied sector or occupations, because what I want to, my end goal in this report was to look at the conditions that these paid care workers are in, and then how can we improve. And then in terms of the policies that I'd like to bring was not to, have better conditions for doctors, but better conditions for example, long-term care workers in the long-term care services, and kindergarten teachers, even though they are highly paid compared to other occupations in my definition of paid care sector. So bottom line is that they have increased from 800,000 people to over 1 million from 2009 to 2014. There has been some decrease in the number of kindergarten teachers and domestic helpers. Kindergarten teachers, because there are fewer kids to care for, so that's why maybe there has been some decrease in those numbers. However, the almost 200,000 increase in the total number of paid care workers is driven by the number of care workers in social welfare services related to workers and medical welfare related to service workers. It's in particular long-term care workers, long-term care services workers. So what are their characteristics from the main labor force survey? 70% of social welfare specialists and kindergarten teachers are full-time workers. There are more stable sort of jobs, especially kindergarten teachers. And then less than 46% for medical welfare related service workers. And there are less than 7% for domestic helpers. And it's overwhelmingly women, like over 90% of my definition of paid care workers were women. And on average, they work 45 hours a week on primary job. But if you include a secondary job, which means they could work on weekends caring for other children in other homes, then it's much higher. Like I think it goes up to 60 hours, but data was not enough to really put all together. So I only looked at the primary jobs here. And care assistants and domestic helpers are more likely to be older. They're older compared to the kindergarten teachers and some social welfare services specialists. And all of them was making less than wages for non-care sector, non-care occupations. And a lot of home health aides or the long-term care services workers, they're not full-time because the agencies don't want to pay benefits to their workers. So they intentionally make it to 35 hours instead of 40 hours. So 40 hours is the regular worker, the time that the full-time definition in Korea. But they intentionally make it to either 30 hours per week or 35 hours per week, because if they hit 40 hours per week, which means a full-time employees, then they need to provide us some benefits, like a health insurance and other things. So but then many agents, evil agents, don't want to do that. So they have capped the number of hours for these long-term care services workers. So it's not that they don't want to work longer. They want to work, they want to be a full-time employee because they can get some benefits, but there are all this conflicts between what care agencies want, or they don't want to pay higher, or they don't want to pay more. So conflict between what they want to pay and then what long-term care service workers need to get. So the wages is women and men in 4 different occupation groups. Kindergarten teachers are the highest paying jobs among all these 4 different types of paid care groups. And the average for women, even in this paid care sector, is $1,000 less than men's wage on average for across all different paid care workers here in the US, here in Korea. So compare their wages to non-care workers. For women, it's a half of what non-care workers are getting paid. So it's a considerably lower than the wages of non-care workers. And also in terms of work hours, care sector, as I said, long-term care services, sometimes they're it looks like they're flexible hours. They enjoy flexible hours, or they work less, but that's not true. The variation within the care sector, care occupations is much larger for work hours compared to non-care sector. So who is missing in this? Globally, 44.3% of the women are, among migrant workers, 44.3% of the migrant workers are women. And within migrant domestic workers, over 73% of them are women. It's from the same report, the ILO 2018 report. So in Korea, I didn't really include the migrant workers there. So let me show you why. So that number, in 2015, women comprised 48% of the migrant workers, and in 1960s, it was not much lower. But what has changed is the nature of women's migration. Many more women from the global south migrate as independent workers rather than accompanying family members. So they go solo to another country. So the nature of women's migration has changed since then. And but they are often the primary providers in their families. With the decline of the welfare state, the increase in proportion of women in the workforce and aging population, as I showed you, the provision of childcare for children, elderly, and the sick, disabled in the global north is undergoing disruption. And women from the global south, and thus migrating to the work of women in the global north as nannies, nurses, and maids, often leaving their own children behind in their home country. And then their children in their home country are in care of another woman, usually a relative or a mother or mother-in-law. So this process of passing the responsibility of the caregiving from one woman to another woman is known as a global care chain, in addition to care work. So I was like, at a societal level, there is a concern about whether migration trends to generate care drain in countries of origin, right? Mothers leave for caring for another person's children, then there is a care drain in their home countries. So who's going to take care of this mother? And in this picture that I found is from the magazine called The Nations. And this is the title of this article was who's going to take care of migrant workers? Oh no, who's going to take care of children of migrant workers? So in Korea, when it comes to migrant care workers who have become significant in the workforce in general, of course, no official data for them is collected in South Korea. So the role of migrant care workers have received greater attention in recent years. But the growing need in Korea for additional care resources for children, the frail, elderly, the sick, the disabled, as well as every domestic work as a result of aging, has posed increasingly difficult policy challenges for the redistribution of care responsibilities among the government, market, and family. So since the mid-2000s, the Korean government has tried to address the care crisis by extending labor market access to non-natives, non-Koreans, such as immigrants and migrants. And regarding migrant care workers, Korea has developed an ethno-specific background. Ito mentioned this last time, so-called co-ethnic migrants. So these are people, Korean-looking people living in China, the northeast of China, and they are the Korean descendants. So they get some explicit privileges. So that's why over 85% of the co-ethnic migrants are Chinese with the Korean origins currently. And about Mo and Park, they kind of try to estimate how many of them in South Korea in 2015. And they calculated, according to their calculation, it's about 60,000 to 80,000, but I'm sure that's an underestimated number. And they are mostly 50s and 60s in terms of age. And then there are many of them, most of them are live-in personnel, personal care workers. So they're living in somebody's home together. And of course, they overwork because once you live in the household that you're working for, then there is a very little boundary between your life and then also life of work, like work life. So your work-life balance is a kind of, that boundary is no longer exists, doesn't really exist in this situation, especially for migrant care workers in Korea. So what does it mean? So I was asked not to put migrant care workers into the total number of care workers. Some people had questions about like how it's measured and why. So excluding migrant care workers, it's still over 1 million paid care workers in Korea. And yet there is less than 10% of GDP on social spending. It's overwhelmingly women, low pay and lack of benefits, and demand and supply gap is growing, increasing and increasing. And then there is a huge missing data about migrant workers and domestic care workers in Korea. So what I want you to discuss is how would you measure the size of informal employment and migrant care workers if you encounter this kind of situations? And what do you think of the consequences of the global care chain for development at a global level? And what do you think of the impacts of those demographic changes? I don't think that Korea is exceptional. I think every country is probably going in that direction. Korea is just going super fast that no one has imagined. So that's why everybody's like kind of freaked out, like, oh my God, what are we going to do with all these old people and then fewer kids? Like, do we need to promote more promote more free childcare for women to have more kids? And how do we deal with all this care crisis? So what do you think of the impacts of those demographic change that you have seen or you may be seeing in your country on paid care sector? And making care more visible. We have talked about unpaid work, and by developing satellite accounts was one of the ways to make the unpaid care work visible. So making this care work more visible in the global development agenda, what care systems do you envision? Like, what do we need to do if you can change one thing? Like, where do we start?